Hello and welcome to my new show, The Big Half. My name is Andy Townsend and I'm going to be bringing you the bigger half of the story from around the world. Now this is a videocast that I've been wanting to do for some time now, to analyse those big stories happening across the planet and bring insight, context and debate. But there isn't a more relevant time for this given the current outbreak of the coronavirus pandemic. And therefore this channel in its infancy is going to focus on the outbreak of the coronavirus, bring stories from around the world because this is a global issue affecting everybody, and analyse what it means for us as individuals. Now this first episode will really go straight to the heart of the problem, and this first episode will look at really how bad the coronavirus is. Well, it's important to stress that we're only at the beginning of the outbreak. So with the number of cases that we're seeing, the number of fatalities resulting either directly or indirectly from the virus, and in terms of the disruption that we see across society, we're only just getting started, okay? And now many experts are predicting that this virus is going to last for several weeks, if not months, okay? So I think this is something that people are only just starting to grasp and come to terms with. And it's very difficult to come to terms with that, especially given the measures such as self-isolation and complete shutdown of cities and countries even across the globe. The idea of being confined to that environment for several weeks, potentially up to 10 to 12 weeks, is quite a frightening thought. And so this is something that I think people are only starting to really come to terms with. Now there was a lot of talk originally about how the coronavirus is just another kind of strand of the flu, right? It's like the seasonal flu. For those that get it, it can be quite severe, but for the majority of people it'll be mild, and for most people they won't even get infected at all. And we're going to look at some of the data in this first episode just to kind of get a picture of where the coronavirus sits, how it compares to other diseases and other things like the flu, like chickenpox, like measles that people get. And so, a lot of people are saying that, it's like the flu, and it does in many ways, it acts like an influenza virus. It's something that transmits very easily through the air. And we have a lot of data now from scientists showing that you're infectious before you even get sick, right? And in some cases you can be very highly infectious. So just breathing is all you need to do to actually transmit the virus. And so we can look at the data here, and this data has been beautifully charted by informationisbeautiful.net. And if we look at the majority of cases here and look at the breakdown between mild, severe and critical symptoms of the disease, you can see that 4 in 5 people, and this is done from a study from the first sort of 45,000 cases confirmed in China, about 4 to 5 of those people have very mild symptoms. And very much the advice from the UK government and many governments around the world right now is that if you have mild flu-like symptoms, just stay at home. The period now in the UK is 14 days, and that includes also family members or anyone else that you're inhabiting your house with. Stay at home, wait for those symptoms to pass, okay? And only if you get more severe symptoms, okay, if the problem persists and gets more severe, then you are to phone either the NHS 111 number or potentially go to your GP, which might lead to hospitalisation. And just under 1 in 7 people who had the coronavirus symptoms in China had severe symptoms, with 5%, so roughly 1 in 20 people who had coronavirus out of the sample in China, 45,000 confirmed cases, 1 in 20 of those had critical symptoms and were placed in intensive care. So that gives an idea of the kind of breakdown of the infection. So majority of them are mild. Majority of people that have the virus will either not have any symptoms at all, or if they've got symptoms, they'll be very mild. Okay, and that is good news. But as we'll come on to shortly, there's not a reason for complacency for much of or if not all of the population. And if we look at the number of people recovering from the virus right now, it stands at around about half. So one in every 2 people are recovering, complete recovery from the virus. But as we know, and this is, as I say, this is ongoing, it's still very much at the beginning, a lot of people are currently ill, and that mortality rate there from this data suggests that about 3.7% of people have died from the virus. And again, I'm pretty sure this is being based on the data we have so far for China. That 3.7% is quite a bit higher than the estimated long-term mortality rate, which puts it at about 1%. So it's expected that of the whole general population, about 1% of people who have the virus will die. We're going to come on to talk a little bit about some of the biases in testing and kind of what the data tells us and what the data inadvertently doesn't tell us. But that mortality rate is likely to be a bit higher here at 3.7% because a lot of healthy people haven't been tested yet. But we'll come on to talk about that soon. If we look at who in the population is most at risk, as has been discussed, I think, quite a lot, it is those 60 and above that are most at risk. And it is those that are currently having underlying health conditions, which most people are aware of anyway. So you should really know if you are at risk or not out there. That are most at risk from the infection. So it doesn't mean these people are more likely to get the virus. It just means that if they get the virus, their symptoms are likely to be worse. And as this data suggests, that 1 in 6 people from that sample, that 45 or so thousand people in China that have had the coronavirus, 1 in 6 people above the age of 80 would unfortunately die from the virus. That goes down to 1 in 12 for those between 70 and 80. 1 in 27 people died between 60 and 69. So you can see that mortality rate there on that chart is decreasing as the age brackets get lower. And you can see some of the common serious illnesses, underlying illnesses that people have that kind of potentially contributed to them dying. So unfortunately, we know that if you were to get the coronavirus and you already have a cardiovascular disease, or you already have a history of having some chronic respiratory issues, high blood pressure, or cancer, which is often the case, then you're more likely to end up unfortunately dying from the coronavirus because your body is less able to fight the disease. And also we see that in the data. So a lot of the younger people don't have these underlying diseases, and that's why often their bodies their immune system is able to fight the disease. And you can see that only 1% of patients in China that had no existing conditions died from the virus, which is about what the long-term estimated mortality rate is. So this next chart I like a lot, aiming to kind of contextualize COVID-19, the coronavirus, in terms of a lot of the other diseases that have been affecting humanity for the last few hundred years. And you can see there where COVID-19 sits. So clearly, in comparison to seasonal flu, it's something that has a higher rate of infection. You see that on the x-axis there, but it also has a higher mortality rate as well. So more people are getting infected, and then of those infected people, more people are dying. And it's those kind of two things that are important. And when a lot of the measures that the governments around the world are looking at are aimed at addressing one or both of those things. So either trying to restrict the number of people that get infected, or for those people that get infected, trying to make sure that the disease is not so fatal. Okay, and that's why you see measures aimed at reducing gatherings, for instance, to restrict the spread, but you also see measures such as, people over the age of 17 not leaving the house, because that's the high-risk population. If they were to get the virus, they would have the worst symptoms of it. And so this chart here, I think, nicely debunks that myth, if you like, that I think is quite obvious now, that this is something much more serious than just seasonal flu. Now, I want to have a look at the current cases. This is something that we're going to do every episode, every day. We'll look at the number of cases out there. This is not meant to be some sort of like music charts where we just see things changing. No, I mean, this is very much just to have a look at the data and try and understand, when we look at some of the measures in later episodes that are being introduced, maybe how effective some of those measures are being, and trying to understand some of the differences. I think before we look at the data for countries around the world, I think it's important to stress that there have been very few things in human history that have affected everybody in the whole world. I mean, we've had issues this year, such as the forest fires, right, in Australia. We see on the news quite often about migration struggles and people fleeing war zones and stuff, maybe from the Middle East, for instance. And quite often we're informed and we're interested to a degree, but quite often we can turn a blind eye. We can just be thankful when we go to bed at night that those problems aren't on our doorstep and they don't affect us. I think what's very unique about the coronavirus is that, this is a global problem. This is something that's having implications for pretty much every country in the world right now. Okay, we're all at slightly different points in that kind of period. If you look at that kind of the growth of the virus and as it kind of spreads, and it doubles every few days, the number of cases or the number of infections, because cases are only the people being tested. What we actually see is that different countries at different point of that graph, but actually everybody's kind of heading in the same direction now, which is a bit of a worrying trend. But it means that when we look at what's happened in China, when we analyse what Korea have done, when we look at the problems in Italy and we look at how they're responding to the coronavirus, we see what's happening in Spain and in France and in Germany and the UK now, the US as well. It paints a picture of kind of what we need to do, and we can analyse some of the measures that are being put in place and hopefully get a bit of an understanding of what is effective, knowing that not every country has the same challenges, different health challenges, different demographics of the population, but it's interesting for us to do that analysis, and that's something we're going to look at in tomorrow's episode. We're going to look at some of the different measures being put in place and maybe try and discuss some of the things, such as closing schools or closing down pubs and theatres or restricting flights. So we'll have a look at that tomorrow. Now let's have a look at the number of cases then. Let's have a look at this video. So you see that this video starts on the 18th of February, and sort of as we progress, we see the Diamond Princess, the cruise ship at the top there, which after China was kind of the first big sign that this thing was happening off mainland China. And South Korea originally have a lot of the cases, obviously due to its close proximity with China. And then we saw an outbreak of the disease in Iran, and very quickly that moved on to Italy. And then Italy has kind of almost become the centre of this European pandemic. And Europe has now been declared by the World Health Organization as this kind of centre point, this epicentre of the pandemic in the world. What we're seeing is a number of European countries now following the same kind of chart of progress as Italy have with the disease. Now, this website is something that maybe some of you have seen people sharing images and data of, so it's something I've been using to look at the spread of new cases. The website is worldometers.info, and it's a really good website to go and have a look at the data. It's being updated almost on an hourly basis. It's charting all the new cases coming in. Unfortunately, the number of deaths as well, which are increasing fast across the world. And you can go in and look at different countries, and you can see some of the graphs that they're populating there, and you can kind of understand a bit about how much things are growing and the rates in different countries. You can see in the UK as of today, Tuesday, we're almost up to 2,000 cases now, 2,000 tested cases of the coronavirus. But you see how the problem in the US has exponentially grown in the last week or so, and now you have countries like Spain and France that have also experienced sort of major growth, again very much following the trajectory of Italy and countries before it. We'll have a look at this sort of every episode and just sort of see if we can sort of track some of these new cases that are coming up, and again talk about some of the measures that are being implemented. If we look at the map, then things are very much as we'd expect. The problem kind of started off in the east, if you like, in China, where the first outbreak was reported, and that kind of affected obviously some of the countries around it, the countries where there's quite high flows of migration, such as in Korea and Japan. And now that's kind of now headed obviously west towards Europe via Iran, and now it's starting to obviously infect the US, and the US is going to be this big hotspot that's only unfortunate situation there is going to get worse. If we look at the cases of coronavirus in Europe, I mean this data's almost doubled since I got this screen grab yesterday. Huge increases in these cases. I mean, you have to bear in mind that in the UK, if you go back not even 2 weeks, we had no deaths and not even 150 cases. And actually, if we go and look at this next chart, you can see here that the exponential growth of cases in the UK over the past couple of weeks, and this thing's only increasing, right? It's only going in one direction right now, especially because we haven't done too much as of yet to really restrict the spread of the disease. Those measures have only just started to come into place the last couple of days. So you can expect this to continue to exponentially increase for at least the next few weeks. Right, now that's the data. So, it's clearly a global issue. I'm sure many of you have seen that data, or at least you've seen elements of it. But you can see we're kind of heading in one direction. But I want to talk a little bit about what that data doesn't show, or at least what that data doesn't tell us. So we can learn a lot from looking at the absolute numbers. We can see the number of total cases. We see the number of people dying. We also get data like the number of people that are recovering from the disease. So the data says quite a lot. But the absolute data, so just looking at the numbers themselves, I think we kind of lose a little bit of an understanding of what's actually happening. Because my problem is that I think a lot of the people that I am seeing on Facebook, that I'm talking to on the street, friends, messaging on WhatsApp, etc., wherever you're getting your information from, I think there's a lot of complacency right now in the UK, but in other areas of the world, that, 55 people have died. Obviously that's very, very sad, but it's a very small percentage of the overall population. This is nothing for me to worry about, 1,500 or as it is now 2,000 cases in the UK. Again, a very small percentage of the population. Majority of people that are dying seem to be old. Me, I don't have anything to worry about, okay? That's what I'm hearing a lot. Now, I want to kind of debunk that a little bit because it's not that accurate. One of the things that we have to understand, and I think something I've been trying to explain a lot, is about testing bias, okay? A lot of the people that are being tested are the people that have the worst symptoms of the virus, okay? So we're almost just testing people that we know have the virus. We're getting a positive confirmation, and then those people are being sent off to hospital. Some of those people will go into critical care units, and a portion of those people, unfortunately, are going to die from the disease, okay? So that's kind of the correlation, right? So it's a very high correlation between the number of people getting tested and the number of people that have the virus, okay? We're almost like testing nobody that doesn't have the virus right now. There's a few reasons for that. I mean, we only have a limited number of testing kits right now. The NHS is at pretty much full capacity. It has been even before the virus. So, there's very little capacity for us to be able to test lots of people and admit them. And so what you see is a bit of a bias in the data. So if we've only got people here in the data that have severe symptoms, we're not testing people that have mild symptoms, right? And that makes sense because the general advice at the moment is if you have mild or moderate symptoms, stay at home for 14 days, self-isolate. If those symptoms go away, then you can assume that you're fine to kind of, continue, albeit in probably what will become in the next couple of weeks a complete self-isolation state for the country. But at least you'll have had the virus and your symptoms will hopefully have gone away and you'll be fine. So there's a challenge there because we're not picking up those people that have the virus or even those people that had the virus and no longer have it. So when we say we've got 2,000 cases of the virus in the UK, what we're actually saying is we've got 2,000 tested cases of people that have severe symptoms of the virus. Okay, that's very different to the actual number of cases in the UK. Now, there's a lot of different estimates that I've seen from experts, on Twitter, on the internet. Lots of people have been doing a lot of models, which is great. It's a great time right now if you're an epidemiologist or economist, etc., to try and do some of these models. And I see a lot of people predicting that the actual true number is likely to be anywhere from 10 to 25 times in the UK. And I'm hearing that in the US, that's actually anything between 25 and 50 times the actual number of cases that's been reporting. So in the UK, if we've got 2,000 cases, we've actually probably got true number of cases anything from 20 to upward from 30, maybe even 40 or 50,000 actual cases in the UK. Okay, so that's quite a big step change in what's being reported. So I think that's the first thing I want to be kind of clear on. In fact, when we see the number of cases, we see 2,000. Multiply it by 10, 15, 20, whatever, it doesn't matter. You start to see the picture, right? There's a lot more people in the UK that have the virus than's being reported. Just thankfully, the majority of those people have the mild symptoms. But there's an important thing to stress here. Just because somebody has mild or even no symptoms, okay, and people can still have the virus with no symptoms, just because they've got mild or no symptoms, doesn't mean that when they transmit the virus to somebody else, that person won't get the virus and have much more severe symptoms, okay? Which makes complete sense, because different people have a different ability to be able to combat the virus. So a very healthy individual could go about their day-to-day life, not even know they have the virus, encounter somebody, pass the virus to them, and that person's body has a completely different reaction to defending against the virus, and that person can have particularly severe symptoms. So that's why I'm going to urge consistently throughout this podcast but also at the end I'm going to give a bit more detail about why there's a responsibility not just on a subset of the population, but on the whole population to try and do their utmost to tackle this problem. Okay. I also want to have a little look at something else in the testing, okay? And that's that a lot of countries have been quite slow to the table to actually test people. I've got this chart here that I've taken from Vox. The data is a little bit old, and it's a little bit patchy in places. Some of it's come from different dates in time. So on average, it's about a week old now. But you can see the tests per 1 million people that have been done, that have been carried out on for coronavirus. So you can see for Korea, for instance, they've managed to test 3,500+ people per million people. Right? It doesn't sound like a lot, but that's still a good number of tests. Okay, I think the data here says 189,000. I think the true number is actually more, 250,000 people by now that have been tested for the virus in Korea. Compare that to just as of March 11th, what's reported to be under 8,000 people that have been tested for the virus in the United States. Okay, with the size of the population in the US, 330 million people, it's only 23 people. 23 people out of 1 million people that have been tested. Okay, so in a lot of places, people aren't even being tested. So not only do we have a bias which says people that have severe symptoms are the ones being tested, but actually in a lot of countries, people that even have severe symptoms still aren't being tested yet, okay? And that's very much been the case in many of these countries. So it could be the case that if we actually tested everybody with severe symptoms, we'd have a lot more cases of the virus. Then when you multiply that to include people that have mild or no symptoms, you get an even bigger true number of the actual people that have symptoms. So what we need to understand is in a lot of these countries around the world, the testing has not been sufficient enough. In the UK, they're desperately trying to ramp up testing. The UK has not done enough. Many countries in Europe and around the world have not done enough testing yet, okay? That's very important to note. We're going to come on in a bit to talk about what South Korea have been doing with their testing and some of the interesting data we've got from that, because Korea has taken a slightly different, or has been able to take a slightly different approach to testing than a lot of other countries around the world. So we talked a bit about the true number of cases, about how there's this bias in the data, and how we've probably got a lot more people in the UK and around the world that have the virus and is being reported. But what's also important that we discuss is how rapidly that is increasing, okay? Now, there's something in epidemiology called R0, okay? And that's essentially an estimate for how quickly the virus is spreading, okay? How quickly it's multiplying over time. Now, for many different diseases, that score can be different, and in many different places, importantly, again, in different countries, that score can be different, okay? And there are many different measures that are being put in place to try and squash it. But generally speaking, the UK have said that every 5 days, the number of cases is doubling, okay? In some countries, that's 4, it's even less. In the US, it's probably closer to 3, okay? The US, every 3 days, the number of cases doubles. So right now, if you're sat there thinking, I don't need to worry about the coronavirus, I can go and do my shopping, I want to go to the bar, why is this restaurant closed? I don't need to do anything about it, everybody's making too much of a fuss. Well, you might be the sort of person that looks and sees there's only 2,000 cases and there's nothing to worry about. Well, what we have to understand is when we account for the true number of cases, let's say 40,000 cases from that, and that's quite a moderate estimate, that number in 4 days, let's say on average, is going to be double, right? So by the end of this week, before even the weekend is out, we'll have 80,000 cases. By the middle of next week, we'll have 160,000 cases, okay? By the end of that week, we'll have double, 320,000 cases. So in the space of about 12 days, we've now got actually a truer figure of about 320,000 cases of the virus in the UK. Now, obviously, measures can be put in place to prevent that, because that R0, that doubling, is essentially looking at how easily the virus transmits from one to another. We can see from this chart, again from Vox, the estimate for the spread of the virus, and you can see for COVID-19, one person typically infects 2 to just over 3 people, okay? That's higher than seasonal flu, it's higher than Ebola, but it's lower than other things that are very transmissible. We can use these estimates to actually have a much better understanding of not only the number of cases today, but also the likely impact the number of cases in the future. And that's why, again, I stress that looking at these figures, although it's useful, and I think the figures are scary enough, I think 56 people dying in the UK is scary enough. I think if one person dies, then we should be doing more. If 56 people are dying, and again, people take, unfortunately, a while to die. That's just the case with this mortality rates. That, healthy people, they will take a while to die. There is a lag between in the data. So you get all these cases, you get people being severely hospitalized. The hospitals try their best to keep these people alive, but a number of them are going to die. So again, we look at 56 people have died. Actually, if we kind of adjust for that lag, that number of people that are going to die if the virus went away tomorrow is going to be way, way higher than 56. Yeah, a number probably 10, maybe 20 times. I don't know. I don't want to speculate on that number, but would be considerably higher. Okay, but so there's obviously a lot of people that are dying from this. Okay, and what we need to understand is that you have to be responsible. Okay, you have to be very, very responsible with what you do because of the effect you're having on other people. Now, in this section, I want to just take a little look at the data for some of the countries around the world and really look at what we can learn in the UK, but also globally from what's happened before. Like I said, this is a trend that lots of countries are following. And so it all started with China, and you can see there that actually, the good news with the case in China, if the data from China is to be believed, that the plateau there at the top suggests that they've successfully managed to restrict the number of new cases in China, having adopted very early, actually very stringent measures by self-isolating the whole population in a kind of national-wide lockdown. You can see the number of deaths there, which is at over 3,000. That's, again, looks like it's the pace at which people are dying daily seems to be slightly flattening out, and again, it looks like the situation there is starting to be under control. I think what's really interesting when you look at this next chart is you see that the number of cases in China kind of diminishing as the number of cases in Europe increase, and again, we see that exponential increase there with the lighter blue, these other countries around the world, and how the number of cases there is just exponentially increasing. None more so than in Italy. And again, for people who are maybe sat at home in England or across the pond in the US, and they don't think that, again, this is something that they should be worried about, go and have a look at what's happening in Italy right now. Because the situation in Italy right now is what's going to come to your doorstep. Whether it's in 1 week or 2 weeks or 3 weeks, it doesn't matter, okay? The situation is going to come. It's going to come faster than you even realize. The measures in Italy will be implemented in other places because this disease is transmitting so fast right now that the lockdown measures, the self-isolation, the absolute cancellation of day-to-day life is almost inevitable. But also, I implore you, not just looking at the data, but actually look at some of the stories coming out of Italy right now. There's a lot of stories from people working in the healthcare system there saying that they're having to make life and death decisions about who lives. That their healthcare system is so overrun that they're actually having to decide who's got a slightly worse symptom, or even worse, whose value of life do we value higher? Do we save this person or that person? Okay, and these are incredibly ridiculously awful decisions that are being made on an almost hourly basis in Italy right now. And something I want to stress, and I kind of mentioned this at the top of the show, is the direct and indirect cases from the coronavirus of mortality, and that's exactly what we're seeing in Italy right now. Is a lot of indirect causes. Okay, so a lot of the pressure of the health system going to tackle coronavirus means that the system doesn't have the capacity to deal with many other illnesses and demands, for intensive care units, surgeries, etc. Okay, so you see how by straining the health service in one sense, you're also having this knock-on effect for other people who maybe aren't affected at all directly by the coronavirus, but indirectly they're having their life and their important healthcare put to one side as a result. So you're seeing this an awful lot now in Italy, and you'll start to see it as well in other countries. So as I said, tomorrow we'll look more at some of the measures that have been put in place, and I think this chart does a good job of kind of explaining why some of those measures have or haven't been effective for different countries. But just in this episode, as we're kind of looking at the trend, the global trend, I think this chart really shows that a lot of countries are following that trajectory that I mentioned before with Italy and China before it. So it shows that at point zero, so at t equals 0, where there's the 100th case has been reported, how many days does it take for you to reach your 500th case, your 1000th case, your 5000th case, etc.? And you can see that a lot of countries are following that trend of a 33% daily increase in cases. You see there China, you see Italy, Spain, Germany. Yeah, pretty much everybody is clustered in that little gap. There's a few countries that are kind of broken away from it, right? And they've managed to essentially flatten that kind of steep increase in number of cases. You see there Korea, Japan, and then Singapore and Hong Kong, two areas that have had fewer cases than most. And we'll look at tomorrow about how South Korea and Japan have been successful in kind of stagnating that kind of growth and flattening the curve, which is something you'll hear a lot at the moment about, kind of where governments are putting their focus. But you can see a lot of countries are following this growth. So don't sit there in the US right now or anywhere else in the world and think that your situation is going to be any different. It's just we're working on different time frames here. Okay. And now we have this the second chart here, which is formatted in the same style. So at t=0, we have our 10th death, right? That's occurred for any one country, and then we're plotting on the x-axis the number of days since that death and how many deaths have been reported in that time frame. So we get an indication of when countries are reaching their 50th death, their 1000th death, etc. And what we can see is that there are actually a lot more differences here than we saw with the spread. What that tells us is that for the previous chart with the spread, it looks like the spread is pretty much consistent with lots of different countries. So actually the measures to try and restrict the spread are not that helpful, right? So that's what the general advice, I think, from countries like the UK has been. Closing public events, stopping flights. They're not particularly effective. Closing schools, right? They're not particularly effective measures for stopping the spread, right? The spread is pretty much the same for all countries, no matter what you do. Okay, it's being transmitted so easily. It's not just wash your hands and don't touch things. It's through the airways. You just breathe for a couple of meters away and you can catch it from someone. So the spread is very difficult to prevent. But what this chart shows is the mortality rate, and actually countries have taken different approaches again to try and protect people, try and protect the most vulnerable people, to lower that mortality rate. Okay, and actually you see there's quite some differences in success there. You can see the UK, which is pretty much following Spain's trajectory there, as one of the countries that's actually having a high mortality rate from the number of days since their 10th death. Whereas countries like Japan and Korea have actually done a really, really good job of protecting their elderly, protecting those most vulnerable, and therefore they've actually managed to keep that mortality rate pretty low. Okay, and so this is again quite important because, as I said, there are two main mechanisms that the governments around the world are trying to pursue. They're trying to firstly restrict the spread of the disease, okay, how many people get the disease, but secondly, and what this data shows is actually the most important thing, where they should be putting most of their energy, is on not trying to restrict the spread, but actually when people get the disease, who gets the disease, okay, and how quickly you're able to intervene, because that seems to be here in the data where the actual difference is being, okay? So protect the old people, protect those that are ill, protect those with the underlying problems that could end up meaning their bodies aren't as capable to fight against the disease. Shelter these people, protect them. If necessary, make sure they don't leave the house, okay? Complete confinement, and then there's a real responsibility for the rest of us to make sure those people stay in that sort of safe house and that safe confinement, and you're not transmitting the disease to them. So again, we'll look at this more tomorrow, but I think just as an overview, it's very important to consider this, okay? So the spread is one thing, but actually where we're having most of impact is on preventing those most vulnerable from dying, and that's very much what I urge people to do. We're going to come on to that in a second. Now, I think a key thing that I wanted to kind of address in this first video, and something that I see a lot, is this emphasis that it's a problem mainly for older people, right? And we saw the data earlier, so I can kind of understand why the first thought might be that if it's only old people that are dying because they're the most vulnerable from this, and most young people, most of the younger generations, seem to get very mild or even no symptoms from the disease if they catch it, then what do we have to worry about? This is a problem for older generations. They're the vulnerable ones. They're the ones that need to take these measures. We don't need to take those measures. Well, It's a very dangerous thought for a few reasons. I'm going to use this data here, which is great that it's available. This Belgian economist by the name of Andreas Backhaus has done a study, and he's looked at the coronavirus cases in South Korea and Italy by different age groups, okay, by different age demographics. And what the data shows is very interesting. So what's important to bring some context to this graph is that Korea and Italy have taken very different approaches to testing. Okay, partly because Korea started the process a bit before, but also because Korea have a history of battling things like SARS, and so they're much more. The infrastructure's there, and the testing kits were able to be produced quicker, and the country was, let's say, a bit more on alert and wasn't caught as cold as maybe Italy and other European countries and that have been by this disease. So Korea have actually been able to have a different approach to testing, which means that they haven't just tested the most severe people of the illness, but they've actually tested a lot larger sample of the population. And we saw earlier that the numbers in Korea, where they've tested about 250,000 people, and I think that number is just increasing rapidly every day. What that means is we get a much clearer image of who's actually got the virus. Because as I said, if you only test people that have got severe cases, then you're only going to get this very high correlation of people, okay? And that means you're only going to really get old people that have the virus, because you're only testing the most severe people and they're old. But in Korea, what they've done is they've tested a lot of people who have the virus. And what it shows here in this data is that 30%, right? 29.9, 30% of people who have the virus in Korea are in the age group of 20 to 29 years old. Okay, so pretty much 1/3 of people that have coronavirus are my age, okay, and the age I'm sure of many people that are going to watch, hopefully, this video. That's quite alarming, because that shows, if we again remember about how easily this disease is to be transmitted, and the fact that you can have this disease with no symptoms, and you can just freely pass it on to someone else who then has very much more severe symptoms from the disease. It shows how important the emphasis on these younger generations to not spread the disease, because on average they are much more likely to have the disease than older people. This is what this data shows. In Korea, people over the age of 70, there's less than 10% of them have the virus. Okay, now that might be because they went into confinement much quicker. Okay, it might be because there's fewer of them. Okay, but that doesn't matter. What this data shows is that 1/3 of people are in the age of 20 to 29. And then if we do the maths of people under the age of 40, I'm doing it quickly now, it's just under half. It's about 45% of people, about 45% of the cases, 45% of the cases of coronavirus in Korea are people under the age of 40. So these are the people that are going, on average, to be spreading the disease. And so if you get younger people who are complacent, who are going around to the bars, to the cafes, to the restaurants, whatever, wherever they can go, they are the ones passing the disease to other people. They are the hosts that are infecting other people on average more than anybody else. So this is why I stress that there is a great responsibility on younger people to isolate, okay, to not go and socialize, to ensure that they do consider the fact that even though they are not vulnerable, the relatives, the parents, grandparents, aunts, uncles, whoever, they are all vulnerable, and they will almost undoubtedly be the ones that pass this virus on to them, okay? So it's not that we don't have to worry because we're not old, we won't die. It's okay, you don't have to be as worried because chances are you won't die. But if you have any concern for your relatives, the elderly people in your life, or just quite frankly, just any kind of social concern about doing the right thing in society, then follow the guidelines. Do what everybody else is doing, get in line, okay? Because you're the guys that's going to be creating the problem here, not the older people. There's a real responsibility here for the younger generations to make sure that they are essentially not making this problem worse. Now, I'm going to finish here just with a quick update, just to sort of fill you in. Actually, just as I'm doing this video cast here, Boris Johnson's been speaking and given his sort of first daily update that he's going to be doing. So I'll probably try and time these around his updates, so UK people, you're getting the most relevant information. A lot of this stuff is changing by the day. So one thing to look at the numbers and realize that the numbers are changing, but we paint a picture. But the advice, I don't want to be giving incorrect advice, but the situation is very much evolving. And so let's have a quick look at kind of what's been been happening around the world. So in the UK, essentially what has been announced that everybody should avoid socialising and avoid unnecessary travel. Okay, this has been aided in the fact that the majority of theatres and bars and restaurants and that have been advised to close. I do have a slight problem in that I don't think the language of the UK government has been strong enough. A lot of it is we advise against, we advise you don't do this, we recommend you don't. A lot of other countries have much more stringent measures that say you must avoid this, you cannot do this. So I don't particularly like the fact that the government seem to be offering kind of recommendations as opposed to actually setting, I think, the terms of how we should live, which I think is more important ultimately. But I'm sure that will come in the near future. So you should work from home where possible, and I think that's something that employers should implement. I realise that not everybody can work from home. The majority of working from home will be unsustainable after a few weeks as well. But hopefully that's with the new financial packages that have been announced by government today. Hopefully employers will compensate people for not working for long periods of time. The new guidance is if anyone in the household has any symptoms, even very, very mild symptoms, so a cough, a bit of a fever, shortness of breath, dry throat, etc., then the whole family have to isolate. Yeah, anybody that's you've come into contact with, anyone in the household has to isolate for a period of 14 days. Okay, and that's just to ensure that you're not spreading the disease to other people unknowingly. And that's because the rate of time that it can take for people to develop the symptoms can be up to about 5 days. So people can not know they've had symptoms for 5 days, you think you're fine, you go out and about, you catch the disease, you've already spread it in that time to several people. So if anyone in your household has any symptoms, 14 days, that's a lockdown, it's a self-isolation. And the government are saying that by the end of the week, so by the end of the weekend, those with the most serious health conditions must be largely shielded from social contact for around 12 weeks. So if you normally have the flu vaccination, if you suffer from anything like pneumonia or you've had a history of underlying problems, we looked a little bit at the data for China earlier about things like having high blood pressure, diabetes, respiratory issues, any of these kind of things. You know who you are. Just don't take the risk, because if you catch the virus, chances are you're going to get it much worse than everybody else. So the advice will be to stay in for around 12 weeks. And again, I appreciate that's going to be very difficult for a lot of people, but it's essential. It's absolutely essential. We've already heard that anyone over the age of 70 has a period of staying inside, I think, of about 4 months. Again, it sounds strict, but it's for the best. And I think this is something that everybody, no matter who you are watching this, needs to make sure that people follow these guidelines. Go and tell the bloody strangers in the street. Shout out your window to your neighbours. Let people know about this, because it's important that they follow these rules. These are not take it or leave it. Okay, some of them sound like that, and again, that's my fault with this. Some of them sound like they're recommendations, but I strongly advise you not to do it. Don't be sitting there if you're 69 years old thinking it doesn't apply to me. Yeah, that's not the case. Okay, it's not like the virus cares if you're 70 or 69. So don't be complacent with it. Just follow the guidelines, and I think a little bit, although I don't want to fearmonger, a little bit of worst case planning is not necessarily a bad thing, especially given that we probably will be in a countrywide lockdown within the next couple of weeks. Okay, that's what the data suggests, and that's certainly what history suggests when you look at the countries that have had this virus a few weeks before us. The advice from the UK is now, or at least the kind of analysis is that we are 3 weeks behind Italy. We were 4 weeks behind, so it suggests that we are actually catching up a little bit. Maybe our rate of growth is higher, which is obviously a worry. And yesterday we heard that not all parts of the UK are on the same point in that curve. In terms of where they are at with the growth of the number of cases of the coronavirus, and London actually has it much worse off than anywhere else in the UK. So anyone in London right now, avoid the underground if you can. Really try and restrict yourself from any form of kind of open space where there's abundance of people. Spend your time in the parks. Just really try and reduce the risk that you could catch this illness, because when you think about where people are catching this, it isn't actually at the sports arena. When they're at the arena, it's more likely to be the 4,000 people they crammed onto the tube with, right, on their way to the match. So, avoid the underground if you can. And quickly, like if we look at other countries around the world, in Europe, we've got France announcing a nationwide lockdown on Tuesday. Starting today and lasting for at least a couple of weeks. Anyone actually breaking that quarantine will be punished, so they're actually enforcing that. The European Union is going to close its borders as of today for 30 days to external visitors from non-EU countries. That's going to obviously put a lot of people out, but I think it goes to show the severity of this. And I think 30 days is a modest number at the moment. I think you'd expect to see that extended. Germany has announced stringent measures, closing shops and venues. They've shut their borders. Switzerland have declared a national emergency. Okay, so this stuff is coming. It's good to see what other countries are doing, because it makes you realise that actually this is not a situation the UK is going to avoid. The UK aren't somehow going to get out of this. Like, everybody is on the same path here. In the US, we heard Donald Trump talking yesterday, saying that people should avoid meeting in groups of more than 10. He did stress that a nationwide quarantine was not yet planned. I think quite sensibly, actually, Trump has come out and said that the outbreak will last until maybe July or August. Again, it's not good to fearmonger people, but I think it is good to prepare people and let them know what's going on and what the likelihood of this period will be. I hear a lot of employers speaking to friends, etc., who have tried to say, it's a 2-week thing, it's a 4-week thing. Some governments are talking about measures for a few weeks. I mean, the football is suspended until the 4th of April. I mean, ignore any date that's in April or even probably May. Ignore it. This is a problem that's going to go on way longer than that. So, of course, everything is going to be reviewed, and there's going to be periods of review, and nobody wants to cancel anything indefinitely, but you have to start thinking that these measures are indefinite until we get beyond this outbreak, and that could easily be into the summer. So, it is interesting that Donald Trump is kind of sensible in saying this. Clearly, only a few weeks ago, he was almost dismissing the coronavirus as fake news, so he's obviously, I don't know if he's read Wikipedia or if he's changed his mind on that overnight, I'm not quite sure, but clearly the President of the US has realised that this is more of an issue than he first feared. And it's also good to see that he's stressed as well the point that millennials should stay at home and they're encouraged to stop socialising. I think, again, that's the completely correct advice. Well, that's it. That's the end of the first episode of The Big Half. Thank you very much for tuning in and joining me. If you have any questions about any of the stuff I talked about today, or you have any ideas for how I can improve the show, or anything you'd think that would be useful to know about for future shows that I'm producing, especially on the coronavirus, then please do send in your thoughts. I appreciate you joining me, and I hope you'll join me again tomorrow.